bit on that because I know that sometimes, in my experiences, I'm like, well, I thought I'd stay local, and you guys have an office in Fort Smith, Arkansas. So does that mean that our blood's going to Arkansas because we don't want it to, kind of thing? Our Arkansas Center is very self-sufficient. They draw plenty of blood to supply the Arkansas hospitals. So again, even though we say we send off, Arkansas is able to stand alone, just like Oklahoma Blood Institute and our respective centers stand alone as well in making terms of having enough blood to collect. So, and I'm going to, on that note, talking about the service map, I also wanted to bring to your attention that I think is very relevant, some of the specific hospitals that we are the sole supplier of every blood product that we send, that we get from donations. Those include that we are the, in Tahlequah specifically, we have both the Tahlequah City Hospital, we also have Hastings Hospital, and then we also are the sole supplier for St. Francis Hospital, both children's hospitals in Oklahoma, all the Veterans Administration facilities in Oklahoma as well. And then to top that off, we're also the partner with every Indian nation in the state of Oklahoma. So that encompasses quite a bit. And so the students that come on campus here, even though they may not live specifically or come specifically from Tahlequah, a lot of your students that come are enrolled here still go back to those communities that we still have their local hospitals, their local Indian nations such as Cherokee, Choctaw, Chickasaw, and so on. So I did want to bring that to your attention because it's something that to me is very, very relevant. Okay, sorry, it's the next slide.
Oh, was it? Okay,
yeah.
You can just skip the next one. We talked about that, and if y'all need a further list, we got that in your packet too. And then the next slide we have is the path of blood and how the blood gets from the donor to the patient. We just wanted to hit base with this just because it's we didn't know if y'all knew everything about it. But the donor is recruited, screened, and if healthy, donors donate. The blood then is taken to our OBI labs for testing and processing, which is in Oklahoma City. We're in Oklahoma.
All of the testing is done in Oklahoma by people that are employed in Oklahoma, that pay taxes in Oklahoma, and all of our regulations and SOPs come out of Oklahoma, so we have full control over the inventory at all times for what's needed for our hospitals.
So go Oklahoma. Blood is separated into components and stored until testing. It's separated into platelets, it's separated into plasma, and it's separated into red blood cells until the testing is completed. The blood is then delivered to a hospital's blood bank, and then it is there for whenever the patients need it and can be immediately transferred to the patient.
There's a little step in between there. Between coming out of Oklahoma City, it goes to these regional, what we call a sub-center, your 1, 2, 3, 4 on your original map there. So Tulsa has their own inventory, and we kind of like spokes from the wheel go out to take care of Tahlequah, Muskogee, Miami, Grove, all of those places. Enid has their spokes from the wheel that come out to take care of their hospitals. So the inventory doesn't stay in Oklahoma City, it stays in the regional areas so that we're better prepared to take care of our hospitals that are out and about from Oklahoma City.
And it's probably more, it's usually surprising, I guess I would put it, what that entails. We have 16 staff that work around the clock that take blood all over this part of the state, and they're taking it back maybe to Oklahoma City or meeting Fort Smith, different things that they're constantly on the move, having that blood rotating out to the hospital. So it's kind of like a daily replenishment that goes on, which is why we have blood drives every day to kind of make sure that replenishment is always there for them to take it.
We do. We need 700 units a day. It's about what's used in Oklahoma, and so somewhere, whether it's collected in Enid or whether it's collected in Tulsa or wherever it comes from, we have to make that 700 units a day to make sure that our hospitals and patients have everything that they need.
So the need for blood is constant. Some organizations that OBI has that we're involved with is Beat the Match Registry. We always had a Beat the Match Registry here.
The bone marrow.
The blood drives here. But Beat the Match Registry is for bone marrow patients who have come down with leukemia and different types of cancers that need a marrow transfusion. But each year, more than 10,000 Americans are diagnosed with life-threatening diseases such as leukemia, whose best or only hope of a cure is a marrow transplant from someone outside their family. 70% of those needing a marrow transplant depend on OBI's marrow program, and others are donated with Be the Match to find a donor. Be the Match registry committed registrants that are 18, 60, in good health, and then they complete the paperwork. There's 4 swabs of the swab in their mouths for tissue type testing, and then it's sent off to our Be the Match registry. So people will either get a call and they can be the match for somebody, or they'll sit in the registry for a while. It's just depending on the different types of marrow that they need.
Did you get a call?
Yeah.
Wow.
Did you?
Yeah, I did.
Wow.
Awesome.
I was having some health complications around that time, unfortunately. So I kind of had to be put back on the list.
But you know that it works and it
Wow.
happens. So
That's
very cool.
awesome. Great.
Well, and also to remind, because Leslie knows this, but and a couple of you know that, but we also partner with our BMAG about at least once a year here at NSU, don't we? That we actually do the bone marrow registry right here along with our red blood cell drive, so it kind of allows your students the opportunity to get back in with one way kind of thing. So,
Another campaign that we have within OBI is a nonprofit. So we have nonprofits. We have the Open Arm campaigns, which allows donors to save lives and make a community contribution. Donors can have the chance to give Debbie, so they can contribute they can forego their benefit, their incentive gift, like we give out with the T-shirt or the cup, and they can choose to give that to our Open Arms organization, who we partner with, and it's like a monetary contribution.
It's a way for us to take money that we would have spent anyway. Let's say the cup is $1. We take that money and give it to, right now it's the American Heart Association. So rather than somebody taking the cup, we give them the $1. It's no additional money out of our budget. Being a nonprofit, money is definitely tight for us, but it lets us let our donors have another way of just giving back to the community. If they choose not to take the T-shirt for the 100th time, they already have that one. Like a lot of our platelet donors donate every 2 weeks, and we have 10 of your zoo shirts. Well, here's how you can help out by giving your zoo shirt back. So,
And other organizations like we've helped out with that are Community Program, American Cancer Society, the Family Society, and then just like the American Heart Association.
if I'm not mistaken, actually, in April, our contribution will be to St. Francis Children's Hospital, Monterey.
not till May.
Oh, it begins in May.
Yeah, the press release has got sent
Oh,
out.
okay, that's what I was going to say.
Yeah.
That was a press release.
This is wrong. Yes, they are. They got
And I
that.
thought,
But
well,
yes,
that's so short-lived.
it's
Open Arms. Okay.
in May. Yeah.
Apologize for that. I was reading the press releases.
And another organization we contribute to is the Global Blood Fund. It's pretty much the same as the Open Arms campaign. The donors can forego the incentive that we give out, and that is the money is given towards supporting different blood supply in different countries.
We usually don't send blood out of the country. It's very rare that we would ever do that. But our idea is to make sure that we help developing nations or people that have had catastrophes like Japan rebuild their blood centers. So in Kenya, the picture that's on your slide there are 2 gentlemen that are donating, and they're laying on the same bed. And we want to, improve those experiences. Would you want to come? Gosh, I hope not. Would you want to come donate blood voluntarily if you had to lay on the bed when it's 90 degrees outside? That's an outside blood drive with somebody you didn't know. So we're really working with these blood centers on improving their experience. All right, you got a table for 2 next time. We got improving these experiences for developing nations and making sure that they're able to depend on a voluntary blood supply. Because right now, if somebody has to have surgery, they go out and say, "Hey, to my family, can you come in and donate for me?" Or they pay donors still in Kenya, like we're at. So we definitely want to make sure that we can help out with those sorts of things.
The next slide is why should NSU host blood drive with Oklahoma Blood Institute?
We probably don't have to hit every one of these since you guys already host a blood drive, and
Yeah.
we can get to the partnership if you want. They can ask questions. This is where you want them for a long time. So
These are the current partnerships we have with NSU. We've done the World